Welcome to the latest update from the OCCS. I'd like to start by thanking everyone in the sector for the fantastic work that they do day in, day out, looking after the eye health of the British public. It's remarkable, given the number of eye examinations and pairs of spectacles that are dispensed, actually how few issues get through to the OCCS. And I'd also like to thank the broad number of practitioners who've been working with us in the start of this relationship to really help us to resolve some of the more tricky issues that come our way. In this section, I want to talk about the real two key common denominators that we come across when difficult consumer issues end up at our door. And those two issues are about the relationship between the practitioner, the practice, and the customer, and secondly about record keeping. There's no doubt about it, the common denominator that turns molehills into mountains in terms of consumer complaints is when the relationship, for whatever reason, breaks down between the practitioner and the practice and the consumer. The clinical competence is really the issue. What drives people to finish up at the OCCS is often the breakdown and the lack of trust that somehow emerges as the issue unfolds. My insight to this and my one bit of advice is, as a practitioner, I really understand how difficult these situations are. And I think what we need to do sometimes to get breakthrough and cut through to resolve the situations is I wonder if we can try and take the approach that it isn't about winning or losing and who's right and who's wrong. Because sometimes I'm not sure we can ever really pigeonhole in such clearly defined terms. The fact is often that a consumer is unhappy with the service and we need to move forward. And my key advice on that would be, if you're faced with a situation that's difficult, can we please try and almost take the emotion out of the situation and just resolve it without feeling as if it's a slight on you or your team, but actually, is it worth the aggravation for what is often amounts to a small refund to bring the issue to closure? And remember that it's often the staff at the front of the practice who have to deal with these irate patients coming back. So, my bit of advice is, obviously try and keep the relationship right, but when things do break down and we reach an impasse, it would really help us to find solutions if every practice that deals with the OCCS can be helpful and supportive as the majority are. And again, that is the common denominator in helping us resolve these situations where a practice can often step out of the emotional mayhem that these issues can create and can deal with it objectively and dispassionately. That really does help the situation. I've said it before and I'll say it again, the key factor that really helps us to help you, the practitioner, is the quality of record keeping. All too often, we get situations in front of us at the OCCS where the record keeping is just not quite at the level that really we require to help resolve the issue quickly. And I would just ask that can we please all be very vigilant and very demanding and be aware of our, the college guidelines and our codes of conduct and make sure our record keeping is as good as it possibly can be. And I would add to that, can we be as vigilant around our dispensing and noting advice as our record cards around dispensing and noting advice around dispensing as we are around our record keeping in the eye examination itself. Again, we do sometimes find that in some cases we may have exemplary records in the consulting room, but somewhat disappointing records when it comes to the dispensing. And again, that just really exacerbates the problem. And it makes it harder for us to resolve the situation in a mutually acceptable way. Jenny Jones and I from the OCCS are going to be out and about next year doing some CET events, and we're going to start to really dig into some of the clinical issues that we're coming across. So I look forward to seeing you all at these events, hopefully at some LOC meetings, and really starting to share with you a bit more detail about the kind of things that are happening, that we're seeing, and hopefully passing on some advice and insight to really help you become more confident at resolving these issues and, of course, hopefully avoiding them happening in the first place. Thank you very much.